So first we're going to talk about disc herniations. Let's review the anatomy really quick because I think it's important to understand the anatomy because it can reduce your fear a little bit around a disc herniation. I know it sounds scary, but let me review this with you. So you have stages of a disc herniation. So the first stage being a disc bulge. And so the disc bulge is just, you have a little bit of that inside material kind of bulging through the annulus, the nucleus pulposus, mostly water, and it's kind of pushing towards the outer edge, but you have no pressure on the nerve root. You have no serious thing going on. And on the inside of the annulus, it's often not even innervated. So most of the time, and I say most of the time because anybody over the age of 30 is going to have disc bulges, you don't have any symptoms related to this. So no one cares what they have until they start having pain. And so no symptoms usually associated with the disc bulge. And if they do have symptoms, it's mild and you're definitely not gonna have sciatica, but it is, somewhat common to have a disc bulge. So herniation time. So the disc herniation is when that annulus becomes really thin on the very edge, most of the time back and off to the side, because that disc material, the nucleus pulposus, is starting to push towards that outer edge, and you're gonna potentially have symptoms with this. And so it is not uncommon to have no symptoms, but it is also common to have some symptoms related to this, and it may just be back pain and glute pain, but you could have symptoms down the leg as well. And so some of that nucleus pulposus is starting to exit that disc and push towards that nerve root, potentially giving you some symptoms. Now, as I'm going to continue reviewing the other stages related to this, you may notice that, hey, I've had an MRI before. It's told me I had a disc herniation. That's why I'm watching this video. And I think it's important to understand the true anatomy around it, that you may or may not have symptoms. And that herniation may have been there for a long time. We just don't know. And the last two stages are the sequestration and the protrusion. And that means that stuff in the nucleus pulposus, including the outer edge of the annulus, things have just been moved from where they should be to the nerve root and exiting towards the spinal canal and just the area of the spine where it should not be at all.